Alzheimer's disease. Alzheimer's disease is a devastating form of dementia that only worsens with time. It affects over 6 million people in the U.S. alone, and most of the patients over 65 years old. And about 10% of patients with Alzheimer's have developed it before their mid-60s. The early onset version of Alzheimer's disease is linked to Down syndrome, as the exon 21 that's characteristic of Down syndrome causes an abnormally large production of the harmful amyloid. This is to such an extent that over 50% of patients with Down syndrome will develop Alzheimer's disease. Similarly, mutations in the APP, PSN1, PSN2, and TREM2 will have an increased risk for Alzheimer's disease. There are also multiple more unknown mutations that also lead to an increased rate of Alzheimer's disease. Due to these mutations and other factors, we are unable to predict who will inherit Alzheimer's disease, but every person has a base 33 to 45% chance of developing the disease. Symptoms of Alzheimer's disease include short-term memory loss, the gradual erosion of more permanent memories, the loss of knowledge of how to talk and even take care of themselves, cognitive problems, and problems with spatial judgment, word finding, and reasoning. Alzheimer's disease is caused by amyloid plaques and tau tangles that surround brain cells, preventing them from being able to communicate with each other. Therefore, the person is unable to talk, to think, and eventually those brain cells will be strangled and killed. There are no effective treatments for Alzheimer's disease, but there are several medications that are in the process of being reviewed to treat this disease. There are several challenges with creating a drug for this disease. Some of them are due to the nature of the tau tangles and amyloid plaques. There are a few challenges with where the tau tangles and amyloid plaques are in terms of the structure of the brain, and there's our troubles with just creating the drug itself.